Hello, Dr. Amar here again, and this is the second lecture in the cardiology series, which will be about symptoms of heart disease. If you have any question, you can email me here at amar@goodrationale.com or comment your question down below. When we are saying a disease of an organ, it simply means that some parts of that organ are not performing their normal function. And what happens following these abnormal functions will be the symptoms. And this rule applies to the heart also. It is no different. Now, when you're taking a history from a cardiac patient, now remembering all the questions you have to ask for, just think about the abnormal functions produced when each part of the heart structure is diseased. Just think heart chambers, valves, and vessels. If any of these structures is not functioning normally, the subsequent events will be the symptoms. I have wrote here in red number 7, which means we have to talk about 7 symptoms, 7 groups of symptoms in heart diseases. Let's start by looking at the heart structure, beginning with the left atrium and the mitral valve. Here is the left atrium and the mitral valve. An abnormal function of this chamber will cause blood to accumulate in the pulmonary vein, causing pulmonary venous congestion. So the first group in heart disease will be symptoms of pulmonary venous congestion. Next, we have the left ventricle and the aortic valve. An abnormal function in this chamber will cause low cardiac output. So the second groups of symptoms will be symptoms of low cardiac output. Of course, we have not discussed any of these symptoms yet individually, but we will in the future. For now, just get the big picture. Next, we have the aorta, which gives just distal to the aortic valve the coronary sinuses, continues upwards and backwards to give brachiocephalic artery, which divides into right subclavian and right common carotid, then the left common carotid, and then the left subclavian artery. An abnormal function of the aorta, or if the left ventricle is not pumping sufficient blood, this will cause decreased perfusion to the coronary circulation, left mid and right coronary arteries, which will cause angina, and decreased perfusion to the cerebral flow, causing syncope. So the third and fourth groups of symptoms will be central chest pain and syncope. Then the aorta continues, branches and branches, to supply all tissues of the body. But if the heart is failing, there will be decreased perfusion to all tissues of the body, causing fatigue. So the fifth group of symptom will be fatigue. Then blood moves into major veins and through the inferior vena cava and superior vena cava, they will drain the blood into the right atrium where the sinus rhythm starts. Now, abnormal function in this node will cause arrhythmias or palpitations. Next, blood moves from the right atrium to the right ventricle. Now, problems in the left-sided heart will cause blood to accumulate in the systemic veins, causing systemic venous congestion. So, the sixth and the seventh groups of symptoms will be arrhythmias or palpitations and symptoms of pulmonary venous congestion. In the next video, we will discuss each group individually. Thank you. See you soon.